Hi, I'm Catherine from Physiotherapy. This video is going to show you how to do self-release of the pelvic floor internally. I see a lot of patients who have hypertonic pelvic floor, which means that their muscles are tense and don't relax very easily. And sometimes, like any other muscle in the body, it's helpful to do a bit of stretching or a bit of self-massage to encourage those muscles to relax. So here's my pelvis. This is the front, the sacrum and the tailbone, the coccyx at the back. And these are the two hip bones at the front that you might feel at the front of your abdomen. To do self-release, I would recommend you use a water-based lubricant or some kind of lubricant that makes you feel comfortable to alleviate any dryness and to smooth the movement of the massage. Obviously, when I'm doing pelvic release, I use gloves, which might make you feel more comfortable, but your bare hands are absolutely fine. Have yourself sitting in a relaxed slump position, maybe leaning up against a wall or at the head of your bed, or potentially I've had even patients lying down on their back with their feet up the wall, just to shorten the distance between your diaphragm and your pelvis. By slumping a little bit, you can reach the pelvis a lot more easily. First of all, it's very helpful to do abdominal breathing while you're doing this self-release. There's a neurological connection between the diaphragm, which sits underneath your ribs, and the pelvic floor, which is the base of your pelvis. And they speak to each other. So when you do diaphragmatic breathing, the diaphragm comes down and the pelvic floor responds by also relaxing. And this often gets lost or missed in a life of shallow breathing, high stress and so on. So by putting your hands on your tummy and doing a minute or so of really deep and long and slow abdominal breaths, that sets up the situation for your pelvic floor release, because the muscles are getting literally a neurological message to start letting go of that tension. Otherwise, you're just fighting pressure with pressure, which is going to be uncomfortable at the very base of it. So once you've done your tummy breathing, I recommend at least a 5-second inhale, not a fast, sudden big inhale and then a slow out breath. You want to do a slow, long in as well as a slow, long out, and you should start to feel everything just kind of feeling a bit more relaxed and comfortable. Then take your thumb, put a bit of lubricant in that area of the vaginal opening, and then just place your thumb at the back wall of the opening. Do some more tummy breaths and feel for yourself, is this resistant to a bit of backward pressure, or does it just go easily now you've got the tummy breath working? If you feel resistance, just wait and do some more big tummy breaths and slow tummy breaths. You should feel after, it may even be a minute or two, depending on where you're at. If you've got severe chronic pain or a real stiffness in the tissues, a real resistance, it may take some time. But it will happen. As you practice the tummy breathing, you will feel a slight softening or a slight give in the movement and the elasticity of the pelvic floor muscles. So waiting there, wait for the breath to soften the muscles, and when they do let go, you should just be able to ease just with the weight of your hand downwards and backwards towards the bed or the floor. Once you get to a point where you meet another resistance, and this may only be 0.5 centimetre to begin with, just wait there, more tummy breathing, and then when it gives again, then stretch down a little bit further. And once you've created a bit more space here, typically if you've got a tight pelvic floor, you'll find it almost like a narrow space to begin with, and that distance gradually expands. Once you feel comfortable to maybe put your finger a little bit deeper, so maybe the top part of your thumb or a little bit further, then you can get a bit more of a bracing against the whole back wall of the pelvic floor muscle, the perineum. Once you've got a bit of stretch, then I would recommend that you can swing side to side. So you'll see there's other muscles coming in from the sit bones here that converge in the middle. It's a very complicated area, but in essence you want to be stretching downwards and backwards, because that lengthens all of these muscles that open up and close the vagina and the back passage, and then working a little bit side to side, because typically there can be stiffness here as well. So sinking backwards, taking your time, and when you feel there's a bit of stretch, then swinging from about 6 o'clock to 3 o'clock, and then slowly back again. Again, tummy breathing throughout. Again, this may take some time. It might take you 10 seconds to get from this back 6 o'clock position all the way out to the 3 and back and all the way out to the 9. It might take 10 seconds for each section. It's super, super slow, and it's lots of long, slow breaths. When you feel like you've reached either a end point of the stretch where you've got a load more space, that's absolutely brilliant. then you're done for the session. If you find that this is just not giving, then don't try and push through it. If you start to fight pressure with pressure, that can cause more distress, more stiffness, more resistance. So just leave it for that session and try again another time, potentially when you might be more relaxed or more rested and so on. If it's not working for you at all, obviously consult your physio to get more guidance specific to your needs. It may be that you've been told you should work one side more than the other, but obviously follow those guidelines as well. I'd recommend doing this 2 to 3 times a week. Once you've done this, you might feel certainly a lot more relaxed, which is brilliant, and a bit more easy to breathe. But it also needs to let time to settle, because this is such a complex area, and this is just an isolated group of muscles in this model, but there's obviously the back muscles and the glute muscles and the hip and leg muscles which all converge into the pelvis. So they may experience very minor aches and pains over the following days as all these things start to adjust again. So give it a day or 2 in between sessions just to let those effects start to settle down. But this can be so effective for relieving pelvic pain, reducing constipation issues and straining, and improving bladder symptoms of urgency and leaks as well. Thanks very much for watching. I hope you found it useful. I'm Catherine from Arcadia Physiotherapy.